Hi, I'm Craig Zaidman from Washington University in St. Louis, and I'm going to be discussing the anatomy of the fibular nerve and the tibial nerve, along with some demos on the ultrasound. So first, let's start with the common fibular nerve, which you will hear me commonly refer to it as the peroneal nerve because I can't change the way I call this name, this nerve. It is derived from the lower lumbar and sacral nerve roots, where it travels as its individual part of the sciatic nerve and then supplies the short head of the biceps femoris in the thigh. It crosses posterior to the lateral head of the gastrocnemius and becomes more superficial and subcutaneous behind the head of the fibula. At this level in the sort of distal portion or mid portion of the popliteal fossa, it is the easiest to visualize. It gives off at around this level the branch to the lateral surocutaneous nerve, which provides the sensation to the proximal aspect of the calf at the posterior and slightly anterior space on the lateral side. And then there's an anastomotic branch, which variably arises to join the medial surocutaneous nerve to then combine to form the sural nerve. It penetrates the posterior intramuscular septum, and the nerve runs in close opposition to the periosteum of the proximal fibula and divides at about that level into the superficial and deep peroneal nerves. Here's a graphical representation of the motor branches of the fibular nerve, as well as its more distal divisions and their motor branches represented here. And here is the dermatome of the lateral surocutaneous nerve here and anteriorly here, as well as the superficial, and then between the first and second web space, the deep fibular nerve. There is anatomic variation in the bifurcation of the common fibular nerve into its deep and superficial branch. This is the most common anatomic pattern here, but you can also see more proximal division here in the popliteal fossa, which is more rare in my experience, or more commonly, it can divide sort of here right at about the level of the fibula. Damage to the common fibular nerve will result in both foot drop with the deep peroneal fascicles, as well as foot eversion weakness from the superficial peroneal fascicle involvement, as well as numbness in the dermatomes just described, including both the dorsum of the foot and the web space between the first and second toes from both the deep and superficial fibular involvement. The superficial fibular nerve is a small nerve, but generally speaking can be identified with ultrasound. It supplies the lateral compartment of the leg, first passing between the fibers of the peroneus longus to then run along the length of the proximal third of the fibula. It passes between the peroneus longus and peroneus brevis, and then it runs through the fascia, dividing the peroneus brevis and the extensor digitorum longus to become more superficial, at which point it pierces the fascia, usually 10 to 12 centimeters proximal to the lateral malleolus. As it follows then more distally, about 6 to 7 centimeters distal to that point, it divides into the intermediate and medial dorsal cutaneous nerves to continue along the dorsum of the foot. About a fifth of patients have an accessory peroneal nerve, which is a branch of the superficial, and that moves to innervate the extensor digitorum brevis, which is typically innervated entirely by the deep peroneal nerve. Here's a pictorial representation of what I'm going to show you on ultrasound with the division of the sciatic nerve with the lateral moving common fibular nerve toward the fibula, as well as the posterior division of the sciatic nerve here into the tibial nerve, which I'll demonstrate. And then here is the continuation of the superficial peroneal nerve here into its more distal divisions. And then here the deep fibular nerve coursing with the anterior tibial artery, which in the video, I apologize, I misidentify as the deep peroneal artery. I just got tripped up on my words there, but you'll hear me misidentify that. And then here, the distal division of the deep fibular nerve, and I'll show you a video of that location also.
Hey, Craig Zaidman. I'm here with Becky Hopfinger, who's working the camera. This is my son Toby, and I'm going to show you the anatomy of the peroneal nerve or the fibular nerve. So I like to start here right at the level of the mid-thigh, and I am looking through the long head of the biceps femoris in order to identify the sciatic nerve. And I'm going to show you now the screen, the ultrasound screen. And the left side of the ultrasound screen is the thumb side or of my hand, and the lateral side. And here you can see the long head of the biceps femoris, and this is the sciatic nerve. So now I'm going to travel distally, keeping the sciatic nerve in view as I approach the popliteal fossa. And here you'll see the sciatic nerve continuing into the popliteal fossa, and here dividing into the tibial nerve, which is going to move down deep this way between the two heads of the gastrocnemius to be just superficial to the popliteal artery main, which you can see here. And then as you follow the tibial nerve down, it goes deep to the cervical. Back proximally then to the bifurcation of the sciatic nerve now to follow the common peroneal nerve, or the fibular nerve here, right here, which you can see in the superficial space. This is the lateral cutaneous there, which is a branch off the common peroneal nerve. And now here, the peroneal nerve approaching the fibula, and you can see it here turning around the fibula as it goes underneath the peroneal muscles to travel down into the anterior lateral space. This is the deep peroneal artery and the deep peroneal nerve running right here. Now I'm going to go back up again, and you can see there, that's the superficial portion, and now joined with it the deep portion of the common peroneal nerve. And I'll go back up again as it approaches the tibial nerve. I'm moving proximally now to form the sciatic nerve at the apex of the popliteal fossa, and here continuing up again as the sciatic nerve deep to the long head of the biceps femoris. Going down again, tibial nerve leads that way, the common peroneal nerve goes superficial and then travels over toward the fibula here, and it's going to then wrap around. The deep goes first to join the deep peroneal artery, and the superficial is difficult to follow in him, but what it's going to do is it's going to arrive right here through the fascial plane between the extensor digitorum longus and the peroneus. I believe this is the brevis. And so you can follow this fascial plane, and you can see here the nerve is sort of arising toward the fascia, and what you're going to see it do is cross the fascia right there. And so that is the superficial peroneal nerve. And Becky, if you'll come back to where I am here, and I'll just demonstrate my hand. So this is about the level of the superficial peroneal nerve here. And then the technique is to just move up this way. This is the fibular head here. And then you move back over to the popliteal fossa and follow up along the long head of the biceps femoris. Thanks. I'll show you some other nerves next.
So it's worth mentioning a commonly encountered bone at the popliteal fossa called the fabella. The fabella is a small sesamoid bone which is embedded in the tendon of the lateral, the head of the lateral gastrocnemius. You can see it just here. And then here it's demonstrated in the sagittal plane. You're looking at the lateral condyle of the femur here, and what you'll see is just this calcified structure that overlies the lateral condyle of the femur. And it's not clear whether the fibella is pathogenic or not, but I do want to show you the variation in how the common fibular nerve interfaces with the fibella. So here is the common fibular nerve here, and you can see the fibella arising there relatively far away to it. I'll just show you here. This is the fibella here, and you can see the common fibular nerve is nowhere near it. Whereas in this person here, who was symptomatic actually from a peroneal neuropathy, you can see the peroneal nerve there runs just over top of the fibella. And I'll just show you that again more slowly. So here you can actually see these, the two little parts of the common fibular nerve here. And you can see the fibella is sort of dividing it. And when you put pressure with the ultrasound transducer, you can sort of evoke this. And so it's not clear to me that the fibella is pathogenic. I think most of the time, if not all of the time, it's an incidental finding, but it is useful to be aware of. The deep fibular branch of the peroneal nerve courses anteriorly around the fibula. It's the first part of the fibular nerve to move around the fibula. And it takes a pretty sharp turn around the neck of the fibula to travel all the way over to the anterior compartment of the leg. And because of that sharp turn and because of all the different muscles it has to travel through, it can get tethered in those intermuscular septum if there's traction, if there's a traction injury. So if you dislocate the knee, for instance, or something like that, you may have preferential involvement of the deep rather than superficial portions of the peroneal nerve. Immediately below the fibular head, the nerve lies along the anterior cortex of the fibula, travels for a few centimeters, and then it continues to travel with the anterior tibial artery lying between the tibialis anterior and the extensor hallucis longus. Then at the level of the dorsum of the ankle, it passes underneath the extensor retinaculum, sends a motor branch to the extensor digitorum brevis, and finally a sensory branch to the inner space between the first and second toe. Here's a pictorial representation of the relationship of the deep fibular nerve to the anterior tibial artery at the level of the extensor retinaculum. And you can have osteophytes at this level or traumatic neuromas at this level, which can cause pathology at this location, though in my experience, that's been pretty rare. So let me show you an example of this.
Hi, I'm going to show you the deep peroneal nerve at the extensor retinaculum here, or what some call the anterior tarsal tunnel. So you can see I have Toby set up like this with his foot here. And I've got the lateral aspect of the body here on my thumb side. And if you look here over here at the image, that's going to be over here at this left side. And so what we're looking at here is the anterior tibial artery and moving distal to proximal. And I'm looking for the deep peroneal nerve, which you can see here, just sitting right on top of the artery. I think I may have called this the deep peroneal artery earlier, but it's really the anterior tibial artery. And I'm moving up the leg here, and you can see here's the deep peroneal nerve just laying medial to the anterior tibial artery, which here I'm compressing. So there you can see the deep peroneal nerve. As you move higher up the leg, it gets very, very hard to see. But because my son is only 18 years old, well, 17 actually, almost 18. It just fit. That's about as good as we can see it. Many people can't see it. So here I'm following the deep peroneal nerve down the leg now, and then what you're going to see is it's going to run right from medial to lateral underneath the anterior tibial artery here. And then it's going to move into its distal divisions, which are too hard for me to see.
Okay, let's finish with the tibial nerve. I already showed you the proximal aspect of the tibial nerve in the popliteal fossa. It also originates from the lower lumbar and sacral nerve roots, runs with the sciatic nerve, and then it passes into the popliteal fossa, superficial to the popliteal artery and vein, which is the easiest way to identify it if you can't locate it as its division from the sciatic nerve. Simply locate the popliteal artery and vein viewing the popliteal fossa from the posterior aspect, and the tibial nerve from that view will be superficial to those great vessels. As it moves distally, it passes between the medial and lateral gastrocnemius and then dives deep to the through the arch of the soleus to then run deep to the soleus. And this is a rare point of entrapment of the tibial nerve called the soleal sling syndrome. It then passes along the underside of the soleus and then ultimately through the medial tarsal tunnel, where it divides into its terminal branches in the foot. And of course, tibial nerve injury results in loss of ankle and toe plantar flexion, weak inversion, and sensory loss over the plantar aspect of the foot, as well as you can have innervation and pain over to the calcaneus. So here is a pictorial representation of the motor innervation of the tibial nerve here as it moves down the posterior compartment, as well as the sensory contributions of the medial and lateral plantar at the foot, the calcaneal branch to the heel, demonstrated here, as well as lateral and medial here. This is the sural, and then the saphenous nerve here and the medial aspect. The video I'm going to show you, we start at the level of the medial tarsal tunnel, and I'm going to demonstrate for you the tibialis posterior, the flexor digitorum longus, then the artery and vein, which is in close approximation to the tibial nerve, here showing its branches of the medial calcaneal nerve, and then the more easily seen lateral and medial plantar. And you'll see that the tibial nerve at this level is in very close approximation to the flexor hallucis longus, for which it can be confused on ultrasound. So it's important to follow it more proximally where it becomes distinct from the flexor hallucis muscle. Here's another pictorial representation of the proximal median nerve, tibial nerve, moving down here, where at this level it'll be deep to the soleus, which I showed you earlier.
And now I'm going to show you the distal portion of the tibial nerve. So I'm starting here in the medial tarsal tunnel, and I have my thumb oriented here toward the medial malleolus in this case, which is going to be the left side of the screen. And what I'm going to do is move both up and down the foot here. So here, looking at the medial tarsal tunnel, what you can see here is this is the medial malleolus, and then here are the tendons of the tibialis posterior and the flexor digitorum longus, and then within the medial tarsal tunnel, the next thing you can see are the arteries and veins, and then you can identify the tibial nerve and the flexor hallucis longus. So here, moving through, this is the tibial nerve here, and deep to it is the tendon of the flexor hallucis longus, which is, I think, right down here. You can focus in here on the tibial nerve, and actually I'm moving proximal, and in my son here, actually now this is the tibial nerve. I'm more proximal than I was before. Here's the artery and vein. Here is the flexor hallucis longus, and if you just want to show where I am over here, Becky, I'm right about this level here. And as you go distal, if you could go back to the ultrasound. So as you go distal, what you can note is that this nerve here is going to divide into this lateral branch and medial branch, the medial plantar and lateral plantar. You can see the division here. See the lateral and medial divisions there of the plantar nerve. There's the lateral, there's the medial, and with some difficulty, these can be followed into the sole of the foot. Now I'm going to move back proximally, and here you can follow the tibial nerve here, which remains in close approximation to its artery. Posterior tibial artery, if I remember correctly. And Becky, just show where I am here. So this is the approach for following the tibial nerve through the distal leg, is to have the leg in this, this external rotation at the hip so that you can image it here from the side. And if you could go back to the screen, what I'm doing is just going to continue to move up through the leg And this is the tibial nerve right here. It stays very close to the artery. Increase the depth a little bit here. And as you approach the popliteal fossa deep to the soleus here, you can see the nerve right here, right against the artery, deep to the soleus. The gastrocnemius over here. And here's the nerve, the tibial nerve here. And I'm really approaching now the popliteal fossa. And if you look where I am right now on him, you can see I'm up again to the level of the popliteal fossa. And at this point, I would put him prone and image this from the back. Thanks.
All right, thanks a lot for your attention to that, and hope to see you in person. It's been a pleasure. Thanks again for inviting me.